I mentioned the opioids only to say, don't use it. There's no evidence that it leads to any lasting clinical response. We as gastroenterologists spend more time dealing with patients who are on opiates than putting them on it. Most of the time, we see the fallout with conditions like narcotic bowel syndrome or opioid-induced constipation. So it can cause constipation, nausea, acid reflux, ileus. OIC occurs in about 60% of patients put on chronic opioids. And then we've identified, beginning about close to 15 years ago, narcotic bowel syndrome, which is in less than 5% of patients put on chronic opioids, but you know it when you see it. These are the patients who come to the ER with repeated visits on higher and higher doses, and you basically have to get them off it. So withdrawal of opioids is recommended when there is insufficient relief of the pain or side effects or other negative sequelae. And I want to show you our study that showed what it did for us. This came out about 10 years ago, 9 years ago, where we brought in 39 patients with narcotic bowel syndrome, meeting criteria, and detoxified them over a week period of time. And looking at the visual analog scale prior to detoxification, and then 1 week later, or whenever they got detoxified, on average 1 week later, you see about a 25 to 30% reduction in the visual analog scale. And this affected other pain areas, not just their abdominal pain. If they had orthopedic pain or muscular pain, it reduced that too. Then we followed them using the North Carolina opioid registry, and we found that they stayed off narcotics. They got as much as a 75% reduction in pain from pre-treatment. But if they went back on narcotics, which we're able to track, the pain went back up. So the message is avoid the opioids. And if you see them, this article does have the protocol in the back for you to view.